Good day, ladies and gentlemen, and welcome to your Funded Projects 1, Home Visiting, Child Welfare Cases, and a Meta-Analysis webinar. All lines have been placed on a listen-only mode, and the floor will be open for your questions and comments following the presentation. If you would like to submit a question at any time during the webinar, you may use the Q&A box located on the lower left corner of your screen. Simply type your question into the box and click on the Ask button. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to your host, Jessica Pearson. Ma'am, the floor is yours.
Thank you very much, and greetings. Welcome to another FRPN webinar. This one is the first in a series that we plan to conduct to bring you findings from FRPN-funded projects. Today, we're going to hear about engaging fathers in home visiting, fathers with whose children are in the child welfare system, in relative care arrangements, and findings from a meta-analysis of research projects or studies on responsible fatherhood programs. I want to give you a little background about FRPN. It's co-directed by Jay Fagan, professor of social work at Temple University, and me, and I direct the Center for Policy Research in Denver, Colorado. FRPN is a cooperative agreement between Office of Planning, Research and Evaluation and Temple University and Center for Policy Research, and we are in our 6th year. We're due to expire September 30th, 2019. We target researchers and programs serving low-income fathers. There are goals of the Fatherhood Research Practice Network are outlined below. First is to promote rigorous evaluation in the fatherhood area, and to that end, we've made 18 awards, a total $1 million for research on responsible fatherhood. And we've also conducted research of our own, developing and validating measures of outcomes for dealing with fathers who participate in programs, and these have been validated for never married low-income fathers, and they're available on our website in English and in Spanish. And we are also in the process of conducting research on maternal engagement and co-parenting. Second, important goal is our objective of building evaluation capacity, and to that end, we have webinars like this one. We produce and post briefs on evaluation issues. We conducting training programs at conferences for fatherhood practitioners on evaluation and its importance, and we develop and disseminate a wide range of materials. Finally, we disseminate information. We have a comprehensive website that you are welcome to check out with all kinds of resources, including tape recordings of our webinar and slides from our webinar presentations, and this webinar will be posted next week or within a few days. We have an online newsletter that we distribute periodically to about 2,500 people, so please sign up if you're not getting that. And we, of course, write and publish articles that are published in journals and disseminated in that fashion. So today, I'm going to introduce you to the presentations that you'll be hearing today, and then our presenters will proceed without bouncing back to me for introductions. The first presentation is by Jennifer Bellamy, Associate Professor of Social Work at the University of Denver, and she's going to be talking about engaging fathers in home visiting. In 2014, we gave Jennifer an award to augment a basic efficacy trial of Dads Matter, which she is conducting with Neil Gooderman and others in the Chicago area. That's a home visiting enhancement designed to engage low-income fathers, and our support allowed her to survey home visitors about their experiences, beliefs, and expectations of father inclusion, and to capture information on parent-worker relationships and father inclusion in services. Her presentation will be followed with a reaction by Audra Stoltz Masterson, who is a social worker and home visitor at the Arts of Living Institute, which is a program of Catholic Charities in Chicago. After that, we'll be featuring a presentation by Kiana Cryer-Coupe, who is an assistant professor of Department of Social Work at North Carolina State University. And she's going to focus on the needs of fathers with children in kinship care. In 2017, we gave Kiana an award to do a qualitative study to better understand the parenting needs of such fathers and how fatherhood programs and child welfare agencies might better address those needs. And following her presentation, Maurice Webb will react and respond. He's a father engagement specialist with Wake County Human Services. Following that, Erin Holmes will present. She's an associate professor and associate director of School of Family Life at Brigham Young University, and she and Alan Hawkins and their team have been working on a meta-analysis. In 2017, FRPN supported this effort to search for published and unpublished fatherhood studies. And for those with requisite data, they assessed outcomes dealing with father involvement, co-parenting, parenting, child support, and employment using meta-analysis. Their study ultimately included 26 published and unpublished fatherhood studies in 34 locations. So let's let the presentations begin. And Jennifer, please start us off.
Okay, thank you, Jessica, for that introduction. As Jessica mentioned, I'm going to be talking about a study designed to test the effectiveness of a new intervention called Dads Matter HV, which I developed along with Neil Gooderman, Aaron Bandman, and Justin Hardy. We all were at one time at the University of Chicago and have since moved on. But our randomized controlled trial was just completed in Chicago. Our final data collection from the last family happened just this last June. So first I just want to give you a sense of what Dads Matter HV is. This intervention was something that our team developed based on some pilot work that we did trying to learn from home visitors and mothers and fathers participating in home visiting services how they thought fathers might best be engaged in home visiting. And what we came up with from that work, and also review the existing programs and literature in the area, was that moms and dads that we spoke with really preferred to participate together in services in the context of standard home visiting. And so what we came up with was a modular enhancement to existing models. And we worked with agencies who were providing healthy families, parents as teachers, local Chicago model called Baby Talk. And the idea is that this enhancement could be layered in and complement the programs that were already in place. So we're not asking folks to replace what they're doing, but rather to augment it. And the goals of this service enhancement were to guide home visitors in the assessment of the father's role in the family, to use specific strategies to engage fathers in standard home visiting services so that they're participating in visits and all the programming that flows from these models, to support the co-parenting team, and also to provide some direct support to fathers around specific issues that fathers told us they really wanted help with. And initially we pilot tested this intervention with a couple of agencies in Chicago and got some really exciting outcomes. The results from that study suggested that Dads Matter could reduce maltreatment risk, improve the mother-father relationship, and also improve the quality of fathering. So we were really excited about that. This slide, it gives you sort of a sense of how the intervention overall is put together. So as families come in to services, we, in the randomized controlled trial that we designed to build off of that pilot study and give us a more rigorous assessment of whether or not the intervention worked, the families would enroll in our study just as they were enrolling in services. And home visitors were trained to do a quick assessment, as I said, of the father's role and determine whether or not he was engageable. And we recognize that, fathers may bring challenges or issues that need to be addressed, and that's the same as we would expect with moms as well, right? So the quick assessment was really to determine if there were fathers or family situations that were high risk and unengageable. So, active domestic violence concerns, things of that nature. But, most families flowed through that quick assessment process and then were engaged in a series of service modules. The first two modules were really focused in on building a relationship with a home visitor, engaging dads in services, and then was designed to move into co-parenting modules. And that's really the heart of the intervention, is helping parents work together as a team to get on the same page in terms of their roles, to build some skills in problem solving and communication, and also work on particular issues that were identified in the assessment process. And then the individual parent support modules are really focused on things like managing stress or getting help-seeking skills fathers told us they were interested in receiving in particular. So hopefully that gives you a quick sense of what the intervention looks like. And the intervention is designed to happen in the first 4 to 6 months of services. So the idea being, as home visitors move through these modules with families, fathers are engaged in services. They participate in home visits as usual, and the content that comes along with that around, educating around child development and creating a safe home and cognitive development, all those great things home visiting does. And home visiting services, many of you probably know, are designed to last 3 to 5 years. So if we're successful in setting the expectation from the start that this is a family service and fathers are an important part of that, the idea would be that fathers would continue to participate in home visits ongoing for the long term. The other important engagement principle I think we built into this, and you saw on the prior slide, was that cycle, is that if fathers are not immediately engageable due to risk concerns or perhaps absence, so we had some fathers who were in prison or perhaps work took them out of the area, the idea is he doesn't just disappear, right? That the home visitor would periodically reassess the family, and if he was able to be engaged at a later stage in services, then Dad's Matter could be layered in at that point. So those are some really important principles that guided the development and implementation of the intervention. The other thing that Dad's Matter HV really does around engagement is using multiple engagement techniques. So for example, technology became really important. I think with younger parents, they really responded to texting. We also had home visitors using FaceTime or other technology to bring parents together. If they weren't able to physically participate in a visit together, sometimes they might call in or use a smartphone, tablet, or something like that. We encouraged home visitors to be creative and try lots of different things, leaving things for dads, working with mom, reshaping standard home visiting activities to include both parents. We had one home visitor, for example, who talked about a standard assessment that she regularly completed with moms that was focused on identifying perinatal depression. And she reshaped the assessment that she would normally do with mom by providing the same assessment questions to both mom and dad, and actually was really surprised to find that the dad in this family had a lot of depressive symptoms that he was struggling with, and it really opened the door then for her to connect him with services, and it was a conversation that she would have normally not had with him. Another strategy I think that was really important in this work was asking about fathers' needs and having resources in place. So a lot of fathers wanted help with employment and other things, many of which moms want help with as well, but sometimes dads need a different referral source. So just having those resources in place for families when these needs are identified was really important. Also to keep trying, if you try at first to engage dad and meet with some barriers or struggle with that, we found our most successful home visitors were the ones that did get creative and kept trying different things. So I think those were really important. As we learned more about how these strategies were being implemented, thanks with support from FRPN, we were also able to do some qualitative work. I think we got better and better at supporting the work of the home visitors within the context of the study as well. So just to give you a little overview of the Dad's Matter HV randomized controlled trial study, this is a multi-site clustered randomized controlled trial across the Chicagoland area. So we had 5 organizations with 17 different home visiting teams, and we collected data from families at baseline, 4-month follow-up, which was sort of the window of time that we expected the Dad's Matter content to be delivered, and then a 1-year follow-up. And we were aiming to get 200 families and got 204. Woohoo! It's always exciting when you can hit your recruitment target. And the families in this study, Dad needed to be a biological father who was engageable, meaning he could reasonably be included in services. Mother and father needed to be at least 15 years old. They needed to be new to home visiting services, fluent in English or Spanish, with no prior child welfare involvement. And that's because this is really a prevention program rather than an intervention program. And children could be aged prenatal to 2.5 years. So this slide gives you a sense of the families who participated in this randomized controlled trial. And you'll see that the majority of the families identified as Hispanic or Latino. We had quite a few families also that identified as Black or African American. So those were the majority of families. And many of our families still had a romantic relationship and were living together, but fewer of them were married. And we also did have some that were romantic but not living together or no longer involved with one another. And most of the fathers were employed full-time or students, and we had some other work and unemployment characteristics as well, though less common. And on average, our fathers were about 28 years old. And these were pretty even characteristics across both arms of the RCT, which we like to see. No statistically significant differences between the two groups. So if our logic holds up, then any differences or improvements that we do see we hope are attributable to the intervention and not differences between those two groups at baseline. We were really excited about the participation and retention rates in this study. So not sure how familiar everyone is with this particular issue within fatherhood research, but retention, well, first recruiting fathers into studies is a challenge, and retaining them over the course of a study is also difficult. So overall, we had a little bit more retention in our intervention group overall than the comparison group. But at 4-month follow-up, we were able to keep 91% of families, so either mother or father or both parents were still participating in the study at 4-month follow-up, and 85% for the control. And that at 1 year, that was 88% for the intervention group and 82% for the control group. So that's pretty darn good, especially for that longer follow-up. Some of the preliminary results I just wanted to share with you, we're pretty excited about demonstrating that the Dads Matter intervention does appear to increase fathers' participation in visits. So for those who were in the comparison group that didn't receive Dads Matter, dads were participating in about 17% of home visits, where in the intervention group they were in 37%. We still definitely have room for improvement, but that's a big difference between the two groups. And you can see that we did some fidelity monitoring. We were looking at dads' participation in specific activities such as assessment and engagement. In both of those areas, we were able to statistically significantly show better engagement in assessment and engagement activities for the intervention group. So we're seeing that this is changing fathers' participation in home visiting. And then one of the things that also has emerged from preliminary findings that I think is a really important piece of data, if you will, to challenge what I've heard from home visitors sometimes as a barrier to engaging fathers, is that the home visitors were saying, well, if I work to engage fathers, I'm really worried that my relationship with the mom is going to be compromised because I'm not able to tend to that relationship because mom will be jealous of the time that I spend with dad. Things like that. So we did look at the relationship between the home visitor and moms and the relationship between the home visitor and dads. And what we found was, regardless of intervention or control group, the mother relationship with the home visitor was not changed. But in the intervention group, those that got Dads Matter, the father relationship with the home visitor was more favorable. So what we're seeing is that home visitors are creating a more favorable relationship with home visitors through the intervention, and it's not compromising the mother-worker relationship as some feared. So I want to end here. I know I'm blitzing through this very quickly. There's a whole lot more I'd love to share with folks if anyone wants to follow up with me and reach out to learn more. But some engagement lessons from this work, findings from the RCT, and just over time as we've been working on Dads Matter. One is that buy into this idea of better engaging fathers in services is important at every level. So in those cases where we had uneven buy-in from administrators or supervisors or home visitors, that really was challenging, and people got sort of conflicting messages about how important it was to engage fathers. And really that the supervisors, those who are supervising the home visitors that are working with families, really were important to setting the tone. So our most successful teams in terms of recruiting families and implementing the intervention with high quality were ones that had strong supervisors. Also, we learned that each organization is unique, and it takes some personalized troubleshooting because home visiting programs look different and teams are different. So having that technical assistance that could be provided to each team was important. But whatever the case was, or particular challenges or strengths of any team, one of the key factors we saw was that Dads Matter had to be part of the routine, the normal routine of supervision, meetings, and reports, intake assessment, scheduling, all of those things, that it's baked in to the process and doesn't feel like something added on or extra. That was much more successful. We also had a lot of struggles with organizational upheaval, teams where they had a lot of turnover, and we had a great deal of turnover amongst home visitors and supervisors in this study. So at 1 year approximately, it was about 50% turnover across the study teams. And when that happens, new things, challenging things like engaging fathers and home visiting really fell to the bottom of the list, if you will, when folks were just trying to survive. And dads, Dads Matter was one of the first things to be backburnered. Another thing that we really learned was that practice and retraining is key. This is not a one-off process, and that some things we felt were really helpful to teams were engaging in role plays, practicing hard conversations perhaps, or uncomfortable conversations when home visitors would tell us they were hesitant to talk with moms about dad's role when they thought dad might have a negative role in the family in particular. But doing those roles, using case examples and other home visitors talking about their experiences and how they managed any of that discomfort was really important. And we found that peer-to-peer learning, those stories and sharing of ideas about how to be creative and try lots of different things were really helpful. And then finally, some challenges with staff and changing culture are more easily overcome. So overall, I would say that most staff, and our surveys of home visitors and supervisors in this study bears this out. They're generally positively inclined to including fathers, but that discomfort and uncertainty was what got in the way. And for most, though, even those that were a bit hesitant, they sort of got over that hump. It just took working on it and practice, this technical assistance and support ongoing. But we did have a few staff that seemingly just did not want to reorient their services to a more family-inclusive or father-inclusive focus. But they were in the minority, and from our experience, most people were able to really turn that ship so that home visiting became truly family and father-inclusive. So just really quickly to wrap up here, I want to acknowledge my collaborators on the research side of things, as well as the partner organizations that were so gracious and allowing us to partner with them and their parents, as well as our funders in addition to FRPN, were the Robert R. McCormick Foundation and Pritzker Early Childhood Foundation. And I think, actually I'll bring this back to the last slide. Now I'm going to hand it off to Audra, one of our wonderful collaborating community members, to provide her reaction.
Hey everyone, can you hear me? I don't know if I'll get a response. Yeah, I was one of the home visitors that participated in the Dads Matter. So our team was approached by the Dads Matter people, and my team was, we had 9 home visitors on my team, and so some of us were given into the Dads Matter experiment group, and the other side were the control group. So half of us were trained how to use this Dads Matter curriculum, and the other half weren't trained until later. I think everyone eventually got the training maybe like 2 years down the line, or whenever the study was done. It was really fun, you know, having another curriculum and having a curriculum that specific focused dads. And it also kind of coincided pretty well just with, I don't know, maybe some sort of cultural shift within our organization, where when I started working at Catholic Charities 4 years ago, all of a sudden dads wanted to be involved, like really involved for the first time. Like they wanted to be involved in the, you know, groups that we did. They wanted to be involved in home visits. And then Dads Matter came along, and we actually had to engage fathers in home visits. So it was very fortuitous. So it was very easy in some instances to implement like a focus on fathers and to do some of the work with these very engageable young men. The way it was funny looking at some of the data, at least with my home visiting program, our dads tended to be a little bit younger. They definitely were younger than the median age of 27. So I'm very curious about what the other teams were, what their compositions look like to give those results. Oh, hello. What's going on with my computer? Let's see. Other beautiful things about the work. We are trying to keep work with fathers and engagement with fathers going after doing the Dad Matter. Like I said earlier, half the people on my team were trained in Dads Matter at the beginning of the study, but now we've all been trained. So now we all have access to the materials, as well as we've made some programmatic shifts. Like we've revamped some of our paperwork to specifically make it gender neutral. So all of our intake assessments, our goal setting paperwork, even some of the paperwork that is, you know, would seem to be more specific to women, such as postpartum depression screens. I've kind of gotten it in our mentality as an organization that this either needs to be applicable to mothers as well as fathers, or just to, you know, whoever the important adult is with the child. So whether it's a mother, a father, we haven't had many, you know, untraditional things like grandparents, but, you know, we would make it work. Let's see. And yeah, it was very fun to participate with everybody, and, you know, we hope that we are continuing work with fathers. I know there are people on my caseload where a father is the primary person that we're working with. So it's wonderful that this does seem to be leading toward more of a cultural shift where where any kind of parent is welcome to engage in work with a child.
Thank you, Audra. Kiana, I think you're up.
All right. Well, good afternoon, everyone. Thank you, Jessica. And Audra, I think you gave me a nice segue in terms of talking about how we might be able to engage grandparents. So I'm Kiana Cryer-Coupe from North Carolina State University, and my project was a needs assessment. It looks at understanding the needs and experiences of fathers who have children in kinship care. So as we kind of think about what do we know about kinship care, what's the backdrop? We know that nationally there's a growing number of children that are living in households where neither of their parents are present. And so my work primarily focuses on households where children are being raised by a relative. And so when we look at the data, we see about 1.6 million of those children are being raised by grandparents, and about 600,000 are being raised by other relatives such as aunts, uncles, or adult siblings. And so when we hear the term kinship care, that's what's characterized by those family arrangements. You'll sometimes hear it called informal adoption or children that are living in relative care, but just to give that context as we get started. So as we think about this idea of kinship care, typically in the research, in the literature, there are two different types of kinship care that are discussed. And so the first would be formal kinship care. And so if we were to look at this grid to kind of see formal kinship care, those are children that would be considered under the auspices of the child welfare system. So they've had a report made and substantiated, and they are either in a licensed or unlicensed relative foster arrangement, or some who are moving towards more permanent arrangements with their relatives through adoption. Those that are in informal kinship care are those who are in private arrangements, and so there's no CPS involvement or no child welfare involvement in that family system, or it could be a voluntary arrangement. So there may have been a case open and a relative stepped up to ensure that the child didn't end up in any type of foster care placement. And so when we look at the actual overview or the makeup of what these kinship care arrangements look like, we see that the vast majority of children that are living in kinship care arrangements are actually in those private or informal arrangements. And so this grid gives a pretty good understanding, or gives us a pretty cool picture of what that breakdown looks like. And so again, the numbers that we stated earlier, about 2.2 million of those children are living in kinship care arrangements. So when we think about what are the reasons for children actually going to live in relative care, there's several reasons. And so there have been multiple kind of convenient sample studies that have interviewed kinship caregivers to talk to them about their perception of why children are in their care. And so very popular, we see the idea of parental incarceration. So a parent is incarcerated, a relative steps up to take care of that child during that length of stay. Many issues with parental substance abuse. Housing instability is one that, particularly in my work, I'm starting to see a rise in parents not being able to house their families and so relying on relatives to be the primary caregiver. And then issues of child abuse and neglect, and the death of one or more parents. And actually, we did an interview last week where the arrangement, the children were in the care because the biological mother had issues with substance abuse and the father had actually been deported. So that's something that we've not really seen much about in the literature, but I anticipate we will continue to see more of that given our current climate. When we look at some of the work that has been done to kind of understand the adverse childhood experiences that children that are in these arrangements are facing, this chart here from the National Survey of Children's Health and the National Survey of Children in Non-Parental Care gives us a pretty good idea. So if we were comparing those who were in formal kinship care arrangements or public arrangements versus those who are in the informal private arrangements, we can look to see that there are some differences in terms of their experiences. And some might argue that in some instances, the children that are living in the informal kinship care arrangements are experiencing higher rates of some of these adverse childhood experiences. So for instance, if we looked at the third line, where ever lived with a parent who was incarcerated, we see that children in voluntary arrangements at 62% of those children experienced living with a parent that was ever incarcerated, as opposed to 49% of those in public arrangements. And so most of the work in the literature has focused on the formal arrangements, those with attachments to the child welfare system. And in my work, I like to argue that we really need to focus more attention to those in these informal arrangements because they have the same and sometimes higher level of risk, but are having access, or the availability of resources that they're able to engage with is not as great as those that are involved with the formal system. So in terms of thinking about birth parents, some might ask, well, what do we know about them? How are they involved? And so some of the work that's been done by Jim Gleason and colleagues at the University of Illinois at Chicago and other individuals looking at birth parent involvement, we find that birth parents are interested in being involved in the families. And so there are some restrictions that may be in place based on the type of arrangement that the family has. So we know that those that are in formal kinship care arrangements may have scheduled visitation or some type of arrangement through the child welfare system that dictates how often and when and where the parent can engage with the family system, whereas with informal arrangements, there's often more flexibility. The caregiver really serves as a gatekeeper without any additional assistance from any agency or service in that way. We also see differences in engagement by the type of placement that children are in, if they're living with a paternal relative versus a maternal relative. So in some instances, we see that maternal relatives tend to gatekeep mothers less so than they would fathers in those instances. And then we also know the issue of child safety comes up. So in terms of thinking about the reasons why the child was placed in a relative placement in the first place, if a birth parent does serve some threat to the child or caregiver's safety, then that will impact the level of engagement they're able to have in the child's life. And then we also see that paternal incarceration also impacts the level of engagement that a father or mother would be able to have in these family arrangements. So in terms of thinking about fathers, I chose to focus on fathers in kinship care families based on my own social work practice experience. So I started out working with grandparents who were raising grandchildren in Baltimore at the Grandparent Family Connections Program through the University of Maryland. And during my time there, noticed that when I was out in the field in West Baltimore working with grandmothers, our assessments, asked a few questions about father engagement, but we weren't really engaging dads in the work. And so there would be a dad, living in grandma's basement or living down the street, and he wasn't really the focus or wasn't really seen as a primary caretaker or the focus of that work. And so really became interested in that. And so when we look at the recent research on paternal involvement in informal kinship care in particular, there has been some work to suggest that father's involvement does have a significant impact on informal kinship care children's social and academic competence. And so as we kind of think about that, there's some recent findings from the Fragile Family and Child Wellbeing Study looking at their year 15 data that shows that we really should focus on these fathers because they are ones that may be at risk for not being engaged, but if we were to intervene early, perhaps we could help with that. And so those dads tend to be younger, they tend to be poor, less likely to be employed, more likely to have had a non-marital birth, and they report higher levels of negative mental health and physical health outcomes when you compare them to children who are living in their mother's care, so the fathers of those children with fathers of children in kinship care. And so again, those findings suggest that it's imperative for us to consider the ways that fathers' characteristics and their capabilities may impact family dynamics in the context of kinship care. And so for my FRPN study, we had a few research questions. And so the first thing that we were interested in looking at is what characterizes the experiences of fathers with children in both formal and informal kinship care. So really interested in understanding their perspective in terms of the challenges that they face in their efforts to be engaged, looking at what types of supports they found helpful in their journey to being engaged, and then what type of supports do they need at this current point to improve their parenting skills. We are also interested in talking to practitioners or providers in responsible fatherhood programs and providers with the local social service agency to understand how do they characterize fathers with children in kinship care. And so what techniques are they using to engage these fathers? How do they compare the needs of non-resident fathers who children that live with biological parents or may live with other foster parents? How do they compare those to fathers with children who have kinship care arrangements? And what adaptations, if any, are they making to their regular programming in terms of approaching their work with these fathers? And so our current sample, we've interviewed 25 fathers with children living in formal and informal kinship care arrangements. And these dads were recruited from local barbershops, some human service agencies here in the Triangle area, as well as using targeted social media ads. And as Jen alluded to earlier, it was really difficult. I initially started out and I said, 25 dads, we can find them. It was much more difficult than we anticipated to find dads who had children in kinship care and that were willing to talk about it. And something else that came up as we identify some of these dads, we noticed that when we started the questioning around whether or not they had formal or informal arrangements, some of the dads weren't clear on the type of arrangement. So as we looked at that split, most of the fathers from that 25 had informal arrangements, and about 8 of them had formal arrangements. They were able to show documentation that they were actually still engaged with the caseworker, or us being able to reach out to the caregiver to confirm what type of arrangement that was. So each dad completed a 1-hour in-depth semi-structured qualitative interview. We've interviewed thus far 17 human service providers or practitioners, and so these have spanned from practitioners in dedicated responsible fatherhood programs. We've talked to fatherhood specialists in some of the local nonprofits that specialize in parenting, as well as talking to individuals from Access and Visitation, as well as a few family law attorneys who specifically work with dads who have children in kinship care arrangements. And we've also completed interviews with 10 kinship caregivers. So we were really interested in getting a perspective from several stakeholders to kind of understand what dads need, what those experiences look like, and not just from the dad's voice, but from the practitioner as well as the caregiver's voices. So as we kind of think through some of our preliminary findings, and I'll just focus on findings from the fathers and the practitioner, because we just wrapped up our last caregiver interview on Friday. But in terms of talking to the fathers, we found that there's this lack of clarity regarding their role and legal standing. And so I talked a little bit about the dads in some instances not knowing the type of arrangement that they had, particularly amongst dads who were returning home from incarceration. We found that they didn't really understand what their role could be in the child's life. So this idea of whether or not they had signed rights over to the caregiver, whether or not the caregiver had guardianship, what that meant, who or what system they would go to reestablish primary care if they were interested in doing so. We had a father that returned home who had a son with an IEP, and this dad was a convicted felon. He had a sex crime, and so he said, well, I know I can't go within 100 feet of a school. The school is not going to allow me to attend his IEP meeting, and so he wasn't sure how it was that he had the legal right to still advocate on his son's behalf, but he couldn't go into the school's grounds. And so in terms of kind of understanding what his standing looked like, that's a story that we heard multiple times. In terms of the relationship between the father and the caregiver, most of the fathers in our study reported having a caregiver that was the child's maternal family member. And for those who also reported a paternal family member, this idea of deference to the caregiver. So they talked a lot about the fact that the caregiver was the one making the decisions. They were grateful that this caregiver from the family had stepped up and decided to provide care for this child, and they didn't want to rock the boat. So they didn't ask many questions or try to make many assertions in terms of what would happen in terms of making decisions about the child's medical care or making decisions about the child's education. And we saw the same thing happen in terms of their discussion of their interactions with child welfare workers, not wanting to rock the boat, so really just doing whatever it was that was asked of them to continue to sail forward. Many of the fathers that we talked to spoke about a desire to improve their personal characteristics before fully engaging with the child. And so there were many dads who talked to us about couch surfing or experiencing some level of homelessness. And so not having the capacity to step in and see themselves as a primary caregiver or a co-parent for their child because they didn't, quote unquote, have it together. Many dads had some experiences with substance abuse, and so cycling in and out of treatment and not feeling prepared to take on that role. And similar to other studies, finding employment was something that was high on the list for many of our fathers. This idea of limited guidance on co-parenting with relative caregivers. So when we talked to fathers about programming that was available to them to assist with the co-parenting relationship, none of the dads identified any resource that they knew that was available to them to assist with that process. So in terms of being able to engage the relative to talk about the idea of potentially sharing decision-making at some point, they were not aware of resources. And then again, this idea of the uncertainty surrounding the capability to assume primary caregiver status. And so there was one dad in particular whose child lived out of state with his elderly mother. And he said, she's trying to plan to move the child here to North Carolina. I have no idea how to enroll her in school. I don't know how to, find medical care or what that process may look like. So there was a lot of uncertainty that came out in relation to these interviews. And there were a few fathers who we assessed at a high level of capability, and some of their situations were that the mother passed away, the child was in the care of a maternal relative, and the maternal relatives didn't necessarily trust the father to do the work. And so in those cases, we had two fathers who had actually hired attorneys to try to obtain custody from the maternal relative. So we did see that agency in that way. So in terms of talking to our social service providers, we went into the work really trying to understand if they saw fathers with children in kinship care any differently than they look at fathers who have traditional non-resident arrangements. And overwhelmingly, the caseworkers, the attorneys, the individuals from Access and Visitation said to us that they engage these fathers in the same manner as they engage any other non-resident father. So there's not a lot of differentiation that's happening. Even those who are working with fathers in primarily kinship care arrangements, they are just seeing them as a non-resident father. And so as we think about the type of providers that we were talking to, we had those who were trained in social work. We had those who received some on-the-job training in terms of how to engage dads, but there was this idea of lack of resources available to provide any type of differential services. And so between having a high caseload, not having the funding to be able to kind of focus on those issues that are particular to kinship care arrangements, those are some of the issues that practitioners talked about. And many expressed a desire to have additional training on working with fathers who have children in kinship care arrangements, particularly some of the folks that we talked to in Head Start programming talked about the fact that they do have relative caregivers that are the ones that are primarily responsible for bringing the fathers into their programming fold. And so they saw it as a potential good to develop trainings that would focus on the ways in which we can engage non-resident fathers and relative caregivers to make sure that their co-parenting relationships are strengthened and that there's clear communications about what the boundaries are and then plans for the future. So we've finished data collection with fathers and the practitioners. We just wrapped up data collection with the caregivers on Friday. So we're looking forward to analyzing that data and getting those findings out. And so we want to thank the fathers and practitioners and caregivers who participated thus far. I've had several MSW students and 2 BSW students who've assisted with this program, with the research, and so I want to thank them, as well as the Center for Family and Community Engagement at North Carolina State University. They funded a pilot study, so we actually have 25 non-resident fathers that were able to compare the kinship sample to. So we have a total sample of 50 dads to kind of look at, as well as thanking the faculty in my department. I was relatively new to the state, and so being able to have those connections to reach out to practitioners and fathers, they were very helpful, as well as the North Carolina Fatherhood Development Advisory Council and FRPN staff for assistance with brainstorming. So now I'm going to turn it over to Maurice Webb, who is a fatherhood engagement specialist at Wake County Human Services.
Hello, everyone. My name is Maurice Webb, and first let me say thank you for the invitation to be a part of this wonderful discussion on fathers. I have a dual role. I worked with Wake County as a senior practitioner working with fathers on parent engagement, coaching, resources, etc., and also have a personal initiative, 21st Century Fatherhood, in which we educate, equip, and prepare fathers for fatherhood, particularly young fathers who have not had fathers in their life or mentors to help them through that process. So that is the context and background that I bring to the work. I have 3 children myself. I've been married for 12 years. I'm actually a former foster youth as well, so I'm very familiar with the child welfare system, and very passionate about making sure that I do my part to help in any way bring about change in our society, particularly with fathers in their role. To echo some of the thoughts that were shared by Kiana, I do think that it is vitally important that fathers are well equipped as they come closer to either kinship care or trial placements. We work primarily with fathers who have foster care cases So these individuals, the children are in foster care, and so we work towards reunification. I work with a variety of fathers from Kinship to also just adoptions. So we work with a variety of fathers. And the biggest challenge that we see is that fathers are, there is a stigma when it comes to systems and bureaucracy. They want to be involved, but they don't want to be involved with the system. So we've taken a unique approach to make sure that we are servicing the dads just as much as we are the children, so that when a child comes into care, there is now a seamless process here in Wake County to make sure that dad gets the same level of care as the child. So a case manager, resources to make sure that he is connected to the proper resources that are available to him, and also court preparation, which I'm really excited about because we have just recently this year started a study and also practice to make sure dads are prepared for court proceedings so that they can advocate for themselves and also for their children as they are seeking to reunify with their children. And we do see dads, a mixture of dads who have been incarcerated, a mixture of dads who have been out of the state for a period of time. Some dads had no idea, but now are involved in the child welfare system by default because the child is placed. And so they are being educated through our program, and our specialists, myself and another team of people where we educate them. We go into the home. We also go into the community, and we make sure that we are giving them every resource that is available to them here in our county. And so what we have seen so far, this is the first year that we have placed this program in existence. What we have seen so far is that the dads are overwhelmingly engaged because there is a sense that there is someone speaking their language, primarily men in roles of working with fathers. We know that in child welfare and human services, it is a predominantly female driven industry. And so when another man shows up to speak to another father, it speaks volumes because that father now feels like he has an advocate. We work outside of the role of the social worker, so we're not doing case management in the traditional sense. We are doing parent education, which we find to be very vital in making sure that children are reunified with their children. So all the case management is done by the social worker. We as parent educators and fatherhood engagement specialists, we come in to primarily work with dads on making sure that he understands his rights, parenting styles, anger management, really getting the nuts and bolts of parenting nailed down. And we're with the father for a 6-month minimum. The father can request more time from a parent educator. And so a lot of time our fatherhood engagement specialists will be with a father well beyond the minimum time period to make sure dad has everything he needs to navigate that process of reunifying with his children or child. And so we are really excited about the results that are going to be coming out to see how dads are reunifying through this program and also through the Kinship placement as well. Dads who are all across the board. Primarily we see that they come in with some level of willingness, but not really sure how to go about being more involved. And so we take them through a process of helping them understand the 5 protective factors, which the state of North Carolina has decided that these 5 protective factors are vitally important to keep a child safe. And so we go through those factors. We also make sure dads have a keen awareness to managing his emotions and anger, because we know that a lot of times when dad has not been involved and he learns about his child being placed in a child welfare system, he becomes angry, actually so. So we work with dads on anger and frustration and how to navigate the court system, appearance, in addition to the employment and housing. So we take it a step further just to make sure that dad has a place to stay, but also he has resources available, so that once he has that residence, he has access to furniture, he has access to food to sustain that placement. So we are really excited and look forward to continuing that work and look forward to continuing to grow in the fatherhood engagement movement.
Great. Thank you so much. And now our third presentation with Erin.
Wonderful. Thank you. I'm excited to talk about this meta-analysis we conducted. And I just want to acknowledge that I worked on this meta-analysis with many people, with Dr. Alan Hawkins, who's also here with me on the phone today, and also Raquel Egginton, who's now a graduate student at the University of Missouri, Columbia, and Nathan Robbins, who's a graduate student at Cornell University, and Dr. Kevin Schaefer, who's here also at Brigham Young University in the sociology department. And of course, like others, we are very grateful for the Fatherhood Research and Practice Network for the funding that they offered us and support in collecting all of these reports so that we could include both published and unpublished reports in our meta-analysis. So first, I imagine most of us are here on this phone call because we know that positive father involvement has the potential to impact children in a host of great ways. So we know that positive father involvement has been correlated with children's social development, their emotional development, their cognitive development, and their physical development across the lifespan. But we know that positive father involvement also impacts fathers themselves. So just two examples from the research are that positive father involvement has been connected with a father's own sense of purpose in his life, has been connected with improved job performance, and also with intergenerational continuity. So connections between not only fathers and children, but also fathers, grandfathers, grandmothers, and their grandchildren. But we also know that despite these positive, potential positive impacts, there are a lot of barriers to positive father involvement. And in our meta-analysis, we were focusing specifically on, first, not residing with your children. So currently, demographers estimate that there are 12 million non-resident fathers in the United States. And demographers suggest that this number is growing. Demographers have also been really invested in understanding low-income families, low-income fathers and low-income couples, because low-income families are at higher risk of experiencing instability, single parenthood, and multi-partner fertility. So the biggest question that we've had is, can government policy help support practitioners and help support researchers who are helping practitioners evaluate these programs so that we can understand what programs are helping fathers and what we can continue to do to support fathers, but also to support their children. So to give us some background, all the research I was talking about has been consistent over 4 decades. But in 1995, President Clinton issued an executive order, and his executive order directed federal agencies to support fathers' positive involvement. And this order was supposed to ensure that federally funded research on children and families would incorporate fathers. And then the Bush administration and the Obama administration continued to support those efforts. So from 1995 to the present, roughly $700 million has been given to support these responsible fatherhood education programs. And there were 3 broad goals of these programs: to continue to provide economic support to fathers and their families, to continue to promote fathers' involvement and also to promote other aspects of positive parenting and to support co-parenting. So as we were looking through the research literature trying to help us answer this question about whether or not government policy could help practitioners, could help researchers, could help fathers themselves, we discovered that there's been less research evaluating the effectiveness of the Responsible Fatherhood Initiative than there has been on the Parallel Healthy Marriage Initiative that was also supported by ACF. So with that in mind, we decided that the time might be right for us to conduct a meta-analysis to try to find a way to statistically and systematically combine these efforts from the 90s forward to see how effective these programs really are and to continue seeing what we can do to improve our efforts. So Jessica mentioned this, but the outcomes that we assessed consistent with the overall goals of the Responsible Fatherhood Initiative included co-parenting, child support, employment, father involvement, and parenting. So let me tell you a little bit more about our process. First, for those of you who are less familiar with a meta-analysis is a statistical procedure that helps us combine data across multiple studies. And as we combine the data across these multiple evaluation studies, we are able to calculate an average treatment effect. And that average treatment effect gives us a sense of how effective these different responsible fatherhood education programs are. One of the things that is really valuable about meta-analysis is that the effects of programs can vary from one study to another. And meta-analysis can help us understand why some of that variation exists. So with that in mind, when you're conducting a meta-analysis, you have to make some important decisions about what studies will be included and what studies will be excluded. And so I've given you some details here on this slide about the things that we decided to exclude. So I'll go through these relatively quickly. But first, when you're targeting a body of non-resident fathers who identify as low income, who are at higher risk, one of the questions comes up: should you include programs that have been targeting incarcerated fathers? And when we were looking through the literature, we did find 49 studies that have focused on incarcerated fathers. But when we started to compare those studies, we discovered not only did they have different outcomes than the outcomes we were targeting, but the nature of the programs, because of the nature of fathers' incarceration itself, made them quite different. And so we decided that, that these programs warrant a separate analysis. We also had to make a decision about whether or not we would include divorced fathers. And when we looked through the literature, again, we discovered that most of these programs were targeting men who were separated, were making decisions about divorce. So they didn't actually, and many times were actually living with the mother of their children and their children still as they were receiving these treatments. So this made the nature of the educational programs also different from the programs that were specifically targeting non-resident and low-income fathers. Also, we realized that a more recent meta-analysis focusing on divorce education programs for fathers had recently been conducted. So we decided to exclude those studies from our study. There are some clinical interventions focused on clinical populations of fathers. Again, we felt these were qualitatively different than the responsible fatherhood education programs we were targeting, so we excluded those. And then there were qualitative evaluations, like the really excellent qualitative evaluation we just learned about from Kiana. But the nature of meta-analysis is inherently quantitative, meaning we have to have a quantitative effect size calculated from that evaluation for us to include it in our quantitative calculations. So we're not able to include qualitative evaluations, even though those qualitative evaluations also give us a lot of really valuable information about the work that's going on in our field. And then finally, there were a number of parenting programs. We actually found 38 parenting programs where the evaluators did not distinguish between the effects for fathers and for mothers. So without the ability to distinguish between those effects, we could not include those in our meta-analysis. What we were able to include is studies focused on low-income, unmarried, non-resident, or currently cohabiting with a different partner fathers. And we did discover that in some of these studies that were targeting low-income, unmarried, non-resident fathers, there was a small percentage of fathers that were low-income but were married to another partner. We decided to include those if the sample included 35% or fewer low-income married fathers, and then we also conducted a statistical test to see if there were differences between effects of programs that allowed low-income married fathers to participate in their intervention. And we found no statistical difference between those that had this smaller percentage of married low-income fathers and those that targeted specifically unmarried low-income fathers. We also included any study that was experimental, like Jennifer's, that includes a random controlled trial that was quasi-experimental, where you have a control group and a treatment group, but participants are not randomly assigned to those groups. And we also were able to include one group pre-post assessments. So there was no control group and treatment group differentiation there in those evaluations, but there was a pre-test and a post-test to try to assess change. We were also able to include not only published articles, but also public reports, any dissertations or master's theses that were that included an evaluation. And of course, we included those reports that had the data we needed to compute the standardized effect size. So just to tell you a little bit more about what these outcomes look like, co-parenting in these responsible fatherhood education programs included learning skills to help strengthen the relationship with the mother of one's children, learning how to communicate more effectively with the mother of one's children, and this also included controlling aggressive behavior, though we did see that many studies did exactly what Jennifer's study did and targeted fathers who were less likely to display domestic violence or be engaged in domestic violence. Co-parenting also included learning skills just to cooperate with the mother, and in some studies also included the overall sense of the quality of that co-parenting relationship. Child support was assessed in these programs by payment of child support, but payment was broadly defined by many programs. So there were in-kind payments and other types of contributions that fathers were making to their children's care that didn't necessarily match traditional forms of payment of child support. Father employment and economic well-being was typically focused on teaching fathers skills that would help them gain employment or help them find a better job. Also included teaching men to be more fiscally responsible. Father involvement focused on any interaction between the father and the child. And then parenting more broadly focused on things like how competent dads felt as parents, how satisfied they felt with their parenting, how much stress they were experiencing as parents, how much self-esteem they had, and other characteristics like that. And as Jessica said, there were 34 different locations included or 34 different sites included. And we've divided our findings based on the more rigorous studies that included a control and treatment group and those that included a one-group pre-post assessment. And because we found no significant differences between those studies designs, I'm just showing you here the results. So first, in a meta-analysis, we're able to collapse across all of those outcomes and calculate an overall program impact. And so those 24 different sites, we found an overall positive but small significant impact. That effect size is a 0.10. So if you're trying to think about how that overall effect size or what that actually means, you could say that about 5% of those in the treatment group reported better outcomes than those in the control group. So you can see this is a small effect, but we hope still a meaningful effect. Then if you look across the outcomes that we were assessing, you see that the significant impacts were in co-parenting, father involvement, and parenting. But we did not find significant effects for child support or employment on these programs. But you also see that there are many more studies that are focusing on co-parenting, focusing on father involvement, and focusing on parenting than those that are focusing on child support or on employment. These effects are all relatively similar, with a significant effect size of co-parenting around 0.15, a significant effect for father involvement around 0.11, and a significant effect for parenting around 0.11. So when we take all of this into consideration, we acknowledge that this is a small effect, but also acknowledge that these small effects are comparable to the size of effects working with a similar population in the parallel program that ACF has been supporting, the Healthy Marriage Initiative. So these are small but still significant effects. And it looks like the places where programs are doing the very best are at helping fathers with co-parenting, helping fathers with the quality of the relationship they share with their children, and helping fathers in their own parenting. But of course, another benefit of meta-analysis is that we can look at places where we can continue to try to improve. So one of the things that we noted is that there is considerably less work in these responsible fatherhood programs focusing on fathers' employment. And we're imagining that fathers' employment is still one of the major barriers that low-income, non-resident fathers are facing. And we suggest that more work might take place here. One of the things that we were really surprised about is that of the studies we were able to include, none of them included child outcomes. So while child outcomes are one of the primary driving factors in the reason that we talk about father involvement mattering, we're not actually directly measuring child outcomes. But there could be some benefits in terms of creating a stronger policy argument if we allow ourselves connections not only between our responsible fatherhood education and men's involvement or their co-parenting or their parenting, but also can show direct connections with children's outcomes. Typically, fathers are the only ones reporting. Statistically, there can be some issues where we find elevated effects when fathers are the only ones reporting about what's going on. We'd like to see, as researchers ourselves, reports from mothers or reports from other program administrators or practitioners about improvements they see for fathers to provide some more rigorous evaluation support for our claims. And then the other thing that we noticed is that in order to include a study in a meta-analysis like this one, we needed to have reports of means, reports of standard deviations, and group sample sizes, even if percentages were also reported. And that was one of the bigger barriers we faced at including more studies in our meta-analysis. We reached out to the authors of these studies and evaluators when we had questions about this information so that we could try to get the information we needed to include them. And we appreciate any of you who responded to our requests and helped us so that we could make this meta-analysis as good as possible. But I guess really our biggest take-home message from this meta-analysis is that evaluation work is still quite limited in this area. Just to give you an example of that parallel Healthy Marriage Initiative, over 300 studies were included in a recent meta-analysis of the Healthy Marriage Initiative. So you compare those 300 with our 34, and you can see quite a major difference. But really, our biggest takeaway is that we hope that people will continue to evaluate these programs they're offering, and we want to see this evaluation work grow so we can continue to know how to make our efforts better.
Thank you so much, Erin. It's time for your questions, which you can either type in or phone in. Operator, do you want to give us an instruction about the number to dial?
Thank you. The floor is now open for questions. If you do have a question, please press star 1 on your telephone keypad at this time.
I'm going to start off and ask, Kiana, did the fathers that you spoke with, any of the fathers know about or aware of fatherhood programs? Did any of them have experience with them? And if so, had it been responsive or supportive?
Yeah, so some of the fathers in our area, there's a local organization who is actually funded by the Responsible Fatherhood and Healthy Marriage Initiative. And so there were about 5 fathers in our study who participated in that 16-week program. And while they found it helpful in terms of thinking about parenting skills, really talked about the lack of information on co-parenting in terms of thinking about how they would best engage with the relative that was caring for their child. So clear need there.
Yeah, and Jennifer, what were some of the biggest barriers to engaging fathers in home visiting? What were you hearing?
I think from the family side of things, what we most frequently heard actually were barriers related to time. So trying to get, families are doing a lot of shifting around while, one parent is working and the other is caring for the child and somebody else is going to school at night. Were some of the most frequent things we heard. It was surprisingly less about either mothers or fathers sort of not wanting to participate. That wasn't something that we heard very consistently. And then on the sort of services side of things, I think it was keeping dads top of mind. I saw a question from Carolyn cycle through there where it was very easy to sort of fall back on traditional approaches in home visiting were just mother and baby focused, but even when dads weren't immediately engageable, always trying to circle back to them and talking about them with mom and keeping dads front of mind. And like Audra mentioned, there's a real culture shift that has to happen. And if you can get to that place, there's a lot more success.
Okay, great. And Erin, was there any group of studies where you found some stronger effect sizes, any type of studies, published versus unpublished? What? Hello, Erin?
Sorry, I thought I had muted and I
You muted yourself. Okay.
Sorry.
Well, I didn't realize that. They're better used anywhere in the mess of studies you were looking at.
So yes, there are differences. So those studies that were published had a significantly higher overall impact. So the overall impact of those that were published was 0.23, and those that were unpublished had a significantly lower effect size. So when we report that overall average, we're also acknowledging that there's a difference between those studies that were published and those studies that were not.
And does that discrepancy exist in the studies of the relationship studies as well?
Alan will join us for a minute and talk.
Yeah.
Yeah, in those studies we didn't see, I don't remember seeing as big an effect that way, a difference between published and unpublished. There are a lot of unpublished studies in the healthy relationships, healthy marriage area. And my memory is that we did not see a significant difference between published and unpublished studies in that area.
Okay. Are there any questions from the floor?
And it doesn't look like we have any in the queue.
What about for home visitors? What do they struggle with when it comes to working with fathers, and what do we have to overcome? What do they have to kind of overcome to do more of that?
Audra, I'm going to let you speak to that if you don't mind.
Sure. So some of the things that my team has specifically dealt with in terms of working with fathers, and is again the time factor is a very big one, because a lot of the times getting two parents at home at the same time for a home visit is challenging. I think someone else brought up the point that there's also just always a small challenge, because the majority of home visitors are women, and sometimes it's a challenge initially to connect, or at least for a young man or a man to feel a connection with a female home visitor. Something that I've actually found that is helpful for that one is if you can get other dads interested first, and then the dads can see that other dads are participating.
Right.
They seem to love that. And then, let's see, just other challenges in general, which are very similar to some of the challenges in couples work. When you're working with both a mom or a dad, you have to be aware of confidentiality, safety, just kind of all these things at once.
Thank you. We're almost at time. I want to respond to one question that was typed in. The slides for this presentation will be posted on our website, www.frpn.org, along with an audio recording, which should go up in about another week. So please go to the site, and they will also be posted, a link will be posted through our newsletter, which will follow this panel in the next week or 10 days. I want to thank the panelists. FRPN will be doing other webinars featuring results from our 18 studies. We'll group them in fun ways, and I want to thank all the panelists for terrific presentations and moving briskly through complex studies. And we will see everybody again in the not-too-distant future when we sponsor another webinar. So thank you all, and have a great rest of the day.